So prior to starting my acute care rotation, I had similar feelings that a lot of students do, that I thought acute care was going to be really straightforward, kind of cookie cutter with our ortho patients, just getting patients out of bed and walking them. And then I got to my acute care rotation and I realized that that was far from the truth. And one of the therapists here quoted it well, I think, when he said acute care was the one place where he used his DPT to the full extent, and I would really echo that. I thought that there was a lot of complex patients I saw here, so liver transplant, oncology, spinal cord injury, stroke, colorectal surgeries, ovarian surgeries, the whole spectrum that you have to be knowledgeable about their diagnoses, red flags to be looking for, effects of various treatments. And I think one of the biggest things and the things I got the best at was screening patients for concerning things or for things that the team needed to be aware of. And I learned that PT is really undervalued in the hospital, even at a place like Mayo, where I think maybe better than some other hospital systems, but you really have to be an advocate for your patient. And I learned that you really have to speak up and acknowledge the fact that your patient has deficits that we can really help with and affect positively. And I think one of the biggest challenges for me here was the emotional side of it. It's a really tough patient population to work with on the medical side, and I had to have a lot of hard discussions with patients and families, and it really hit me hard, but at the same time I've learned to be really fortunate and blessed to be a part of these patients' care. And also, I think you just have to be really flexible. You've probably heard this before in acute care, but your day rarely ever goes the way you anticipate, and so just trying to do the best for your patients with the time you have is a really important part.